My name is Casey Cashman, and I am the director of the Pediatric Pain Warrior Program through the U.S. Pain Foundation. U.S. Pain is a national nonprofit organization. Our mission is to educate, empower, connect, and advocate for all individuals who live with chronic illness or serious injuries that cause pain. This includes kids and their families. Our Pediatric Pain Warrior Program helps children with all different types of conditions, including fibromyalgia. Through the Pediatric Pain Warrior Program, we provide free resources for the pain warrior and their families, such as a webinar, print and online materials, peer-led support groups, a week-long family summer camp, community educational days in children's hospitals, and much, much more. Our overall goal through the program is to make sure the families feel educated and empowered, while the pain warrior feels validated and heard. We know the impact pain has on families and the challenges our pediatric population faces seeking care and tools to manage pain. I recently had the opportunity to speak with Dr. Anke of Children's Specialized Hospital of Rady's Children's, who discussed pediatric pain in depth. Kids living with pain and their families face a unique set of challenges everywhere from doctor's offices to classrooms. With limited options available for children, the subset population within the chronic pain community is vastly underserved and underrecognized. My name is Casey Cashman, and I am the director of the Pediatric Pain Warrior Program through the U.S. Pain Foundation. We believe that disease state and patient-focused education is fundamental in helping improve patient-provider relationships, increasing positive treatment management outcomes, and ensuring families are more connected to the healthcare systems. In fact, it is through information that kids can start to find their new normal and tools to better manage pain. The Pediatric Pain Warrior Program helps to address the unmet needs of these families. With me today is Dr. Anke, Program Director and Pain Psychologist at Children's Specialized Hospital Inpatient Pain Program at Rady's Children's Hospital in San Diego. Dr. Anke, thank you for joining us today. I'm so excited to be having this discussion as we take a deep dive into some of the unmet needs of this community. I would love for you to briefly explain Rady's pain program.
Sure. Thank you for having me. And Cassie, you already really hit some points there in your introduction because there's such an unmet need and there's such a need to really bring more awareness to where families and patients can go. So I'm a program director here at Rady's Children, at the Children's Specialized Hospital Inpatient Pain Program at Rady's, and in our program, we see usually kids typically around 9 to 21 years old. It's a 4 to 6 week inpatient program. And as hard as it is, we never want to have a child come to the hospital. But often at this point, when they had chronic pain so long, they're not functioning anymore, they usually really need that intensity of help. And often one of our stories that we hear over and over again, and maybe we both can change this, is basically bringing more awareness to this. So these families don't struggle for years and these kids declining more and more in what they can do and really, having more of a decreased quality of life. Yeah.
Yes. So can you tell me, what does a multidisciplinary care mean?
All right. Well, let's start with the top. So, because often that's forgotten, it's really the first most important person is the patient, so the child. And they're a big part of the team here at Rady's Children's Hospital. And basically, it incorporates all the different staff members that you need. So for our program, that means we are working with physical therapists, we're working with occupational therapists together. Then also as a psychologist, but also things like swimming, yoga teacher, an artist coming here, and also for sure our doctor, the attending that rounds on the patients daily, as well as sometimes we have psychiatry come because there are psych issues with these kids at times where they need more help than just the coping skills. And so, but really the important part about multidisciplinary is that everybody works together with the patient, with the family. And we do that here. We separate that a little bit because we actually round up every week with our patients and we look with them together. How did your week go? What are your goals? And it's their goals. It's not our goals, but it's their goals where they want to go. And I think that's often the important part, that there's a lot of conversation, a lot of collaboration within the team and including the patient and family.
So you touched on a couple different points there, and two in particular is the first one is the individualized part of that. Is everybody who comes here and with chronic pain, is it an individualized approach? I mean, or is it a one size fits all when it's dealing with the pediatric pain, or is it in the program, or is it kind of you take everybody and you deal with the program and you figure out what's going to work best for them?
Good question. So yeah, so a child, I could see two kids with the same disorder, and yet how they present, what they need is so different. So it needs to be individualized, and that's why it needs a big team, because different things work for different kids. And so the patients usually see our therapist in individual sessions, but it is also important to have group sessions because these kids often did not have any more social interactions with their friends. Often they end up being more on social media, but not seeing somebody in person. And more important, they don't see somebody that has the same thing than they do. So they often feel very isolated. So that said, yes, it's individualized. You have to really start where they are when they come to the program, where they're at, and then build from there really gradually and slowly. And that's why we have so many therapies throughout the day. So we really, if something didn't work so well in one session, let's try in the next session. Because as we know, and as our patients know, it always changes throughout the day what they can do, but it's individualized. But I think again, it's important for them to have these groups so they can have fun with each other and interact with each other.
That's fantastic. The other point that I wanted to touch base on that you had mentioned was kind of that can you talk some more about that mental health piece of it that you had mentioned? Some people need a little more help there, and the psychiatric piece of that. Can you kind of talk some more about that?
Sure. So a lot of times, as you can imagine, these kids have gone through many months and years of living with chronic pain, and eventually it takes a toll on your mental well-being. I do want to stress out that there's a lot of kids, they start out with physical pain, and then because nothing changes, they go from one doctor to the other, they have failed treatments, nothing works, they often become hopeless. And as you can imagine, anybody, you and me, we would start feeling more sad, feeling more depressed, feeling anxious. And so what is so important is really to be able to provide them with a well-rounded approach of treatment. And that's why, because it does impact them. And sometimes we talk about the chicken and the egg, because sometimes you don't know what comes first, but what we do know that they are both connected. And so, and we know also if their functioning gets better, then we know the mental health piece with time will also get better. So it's so important to address them both because they are eventually affected by both. And one last thing I wanted to say is, and I'm talking here from many patients that have come to the program, is that they often feel so misunderstood because they go from one person to the next, and there are still some people that say, well, it's just just in your head. It's just something, you know, if you just put your mind to it, you can get through this. And this comes from the school sometimes, from family, and from the medical profession. But it's most of these kids, their pain is real. And if we can start validating that, I think we can come a long way of understanding these patients a little better.
I can't agree more. I mean, the minute that we can validate and to the pain warriors, to their families, to their siblings, that just those words alone and saying that we hear you, we believe you, and that we support you, what a difference that makes for those individuals and those families, and just the difference that makes. It really does make a difference for them. And then I know that you had also kind of touched base on the importance of that the program really focuses on. It is an individualized program, but there is also the component of finding a community. And I know that with our program and what we've done is with our retreats and with our summer camps and the importance of finding the community and the importance of from the support and from the parent side, from the sibling side, and from the pain warrior side. I know that's been such a big piece of it, and you know, from the isolation to now finding somebody who truly understands what you're going through. I would assume you guys see that as well here, that just what it's like when you find somebody who understands what it's like. Do you feel that as well then?
Yeah, absolutely. So good point, I think. And again, it's really trying to get them out of their isolation. I know you saw it, but in our treatment room, we have on the top of our ceiling, we have all these messages from former patients. And that's the first thing patients see when they come here to the program. But also usually we have about 2 to 4 patients here in the program. And for them to connect with them is so important. Sometimes these things last forever. I know one of our patients, 2 girls, they're now together at a college. But a lot of times these kids, they stay connected. And just as the US Pain Foundation, the camp, it's so important for them to see other kids and be able to be heard and be able to know that they are not alone. There are other kids like this. And that always goes a great way just to getting them out of that piece of I'm feeling alone. So here too, they're connecting with other kids, and it seems to be, it doesn't matter if there's an age difference of a few years, they know what the other person goes through, and sometimes these things last for a lifetime. But I know from a lot of my patients that I stay in touch with well beyond the program, that they often connect with them via social media. Sometimes they are visiting each other. So again, it's so important to get them together.
It is. This is when social media we can use it to the benefit, right? Is that this is when technology can be used for the greater good, is that it doesn't matter where you are, right? That in today's society, that these kids can stay together and can connect, and it doesn't matter where they are.
Mm-hmm.
You know, we have found that with some of our kids and with our families, that really, you know, some self-management techniques that we have found really beneficial to some of them is kind of the pacing techniques. And, you know, some different tools would be, and the importance is, you know, how to pace really. And, you know, because sometimes in the mornings we feel the best, sometimes at night we feel the best. And, you know, when you are feeling so good, you're thinking, okay, I'm going to go and I'm going to do everything. And, you know, but how do you guys handle that? And, you know, do you guys have ways that you teach these individuals how to kind of pace themselves and, you know, and things of that nature?
Yes, good question. So I think, yes, thank you for talking about, because it is important. So one message is really, if you're out there, to functioning is so important, no matter at what level that is. So most of the kids, when they come here to the program, they're spending a lot of time in a bed, on a couch, they are maybe in a wheelchair, maybe they're having some other assisted devices, but it's so important to keep them moving. And that's really often our first goal here in the program, is to bring back the functionality. And we know when function is back, eventually the pain level can also decrease. But first, it's really that's functioning. And they have a lot of fear about that, because in their mind, they go, well, if I do more, then it's going to hurt more. And that is probably true. But if we can, and that's why it's so important what you said, that it is that gradual approach. So you don't want what we call here a boom and the bust. That means if I feel better, I do a lot, but then the next day or the next days, I can't hardly do anything. So it's so important to have that gradually process. And it's the process, right? Because it goes upward for these kids. And then to be mindful. I think that's another big piece here in the program, that if you have a moment, a flare up, is to, okay, what do I need to do to take care of myself? But does it always mean I need to lay down in bed? But maybe I can just sit on the chair and not right now go for the walk. And so we often really work with the kids here to do this gradually and mindfully. And also, again, if at home, to continue this, because the reality is they probably leave here and they're still going to have pain, or they still have their condition and it can flare up, as we know, but that they have tools where they know what they need to do. So on a bad day, I can do these sets of things. On a good day, I can do these sets of things. So it's really, really important for them to learn that.
No, that's fantastic. And then, like, do you help them in teaching them how to set kind of like the realistic expectations, right? I mean, we'd all love to run the marathon, right? But we can't go from not running at all to running the marathon. And, maybe you start with running a mile, and how do you help them to teach them how to set those kind of realistic expectations, and what does that look like?
So here in the program, we are really big on for them to independently know what they need to do. And that's why we have parents involved, but through the day, we really work one-on-one with the kids. And we every day in the program, we think, how can they be more independent? How can they manage this more on their own? And that's the first thing we think of when they come here to the program. And that's also when they leave here, that's what we want to make sure they leave here with a good pathway, because often they don't have that pathway. So how we teach that is really by checking in with them. Well, how was this exercise? Was this easy, moderate, or medium? Where are you feeling today? Emotionally, physically, mentally. And so really kind of they learning to check in with them in the morning at any point during the day, and then making a decision, okay, what do I need to do right now? And obviously the team here helps them to make those decisions. And then we do want to push them a little bit, because what we really like to do is if we can have the patient go through, and they do, by the way, through harder moments, that really sets them up for success when they go home, because they maybe have those moments again when they're home, but then they had worked with our team through this difficulty to this challenging moment, and they learn really at that point what they need to do. And so really setting them up for success when they go home.
That's fantastic. Listen, we have talked so much about this, and do you have any words of advice out there for any parents who could be listening right now, if their children are there's parents out there who are listening, and their children are living with some chronic pain issues? Like, what advice do you have for those parents right now?
So I think one thing is, no matter if you're the child or the parent, I don't want you to give up hope. You always have to keep hope, even though you maybe have seen so many professionals, tried so many treatments. But I think most important is really to keep on looking. Ask your doctors, I don't want you to give up. I don't want you to think that this is how life will be the rest of the time, and so I think it's really knowing that there's help out there, knowing that they can, find resources. That has helped so many patients here. And I always say, any patients that comes here, they are improving by the time they leave here. They're not done with it, but they're still knowing what they need to do when they leave home, when they leave here and are home. So I really want you to keep on reaching out, keep on and not giving up. And because there are treatments, there are therapies out there that can help your child.
I agree with that 100%. And I guess my advice would also be that believe in your child. And that would be my number one piece of information from my standpoint, is to really just never stop believing in your child and believing in your gut instinct as a mom, to really just, never stop fighting, and know that there are resources out there, such as, these types of inpatient programs, such as the U.S. Pain Foundation's Pediatric Pain Warrior Program. There are resources that are out here for you, that we can help you, and just to really seek those out and to find that support would be my piece of information. Now, the next question is going to be, if there are any children who are watching this right now, what would your takeaway be for those children?
Absolutely. So I think the first thing I would tell them is that we know your pain is real, because we talked at the beginning about it, how often they don't feel validated, they don't feel people believe them, or they feel that's something that they have in control to do. But I just want to let you know, we know your pain is real. I don't think any child, any person would want to have pain and want to stay home and not live a full life. But I also want to let you know is, if you're at home, if you're not yet in a program or connected to any kind of a provider that can help you, is try to keep on moving if you can, even if it means getting out of the bed, sitting in the chair. And so I think I just would say, yes, we believe you. I think we both know what these kids go through, that this is real, and it is real, and that there's help out there. I think that's really important. So
again, I'm going to agree with you there, and I'm just going to sit here and say that I'm there with you. I believe you. I support you, and we are here for you, and utilize our resources, and that let us be here to help you on your pain journey. And most importantly, just let us help you find that support. You are not in this alone. You do not need to feel that you are in this alone, and that I know that at times you can feel like you are on this island and that you are the only one, but I promise you are not. And if that is the only thing that you get out of this entire recording and session, is that you are not in this alone, please let that be. But you 100% are not in this alone, and that there are people out here that are fighting for you, and that we are here for you. So, is there any other information that you feel that we did not cover that you want to make sure that individuals hear?
I just want to say again, we talked about so many things today. I hope you get from this, again, the message, yes, you're not alone. There are treatments out there. They have been working for many kids. And I think most of all, I want you to keep on believing. I want you to keep on dreaming, and hoping that it can be different, because it's really, that's what life is all about, right? Is to be able to do the things that you want to do, and that there are that there are organizations that, like U.S. Pain Foundation, like this program here, that can really help you to get to that place. So keep on believing, keep on dreaming.
As you just heard with Dr. Anke, there is hope, and there are options available for you and your pain warrior. Please reach out to us at the U.S. Pain Foundation's Pediatric Pain Warrior Program to learn more. Don't give up. Don't lose hope. My promise to you and to everyone out there is that there are people out here fighting for you. There are people out here to help you on your pain journey. Utilize us. We are here for you. And please remember, you are not on this journey alone.